Hi, everyone. My name is Dr. B. I'm one of the naturopathic doctors here at Anasa Personalized Medicine, and I'm so happy that you could join me today. So thank you for clicking on this video. I am here to explain one of the newer therapies that we are adding to our list of services here at Anasa Personalized Medicine. This one being escharotic therapy for cervical dysplasia. If you are subscribed to our newsletter, then this is how you found our video for today. But hopefully, you've seen some of our great news about our expansion with new services like nutrition, massage therapy, and now escharotic therapy as well. And we've put out some newsletters about it. There's also an ad in the Natural Awakenings magazine. So I've had a few patients ask me about this particular therapy because they've never heard of it before and wanted to know a little bit more about it. And we're asking about some questions and things like that. So I figured that I would create a video for today so that we can explain what escharotic therapy is, what to expect with that, and what it's used to treat. And so let's kind of just jump right in. So escharotic therapy is a type of therapy that was created by naturopathic doctors, one named Tori Hudson, who specializes in women's health. And she has always felt like there has been a need for other options for those with a cervix that have abnormal pap smears, which is what cervical dysplasia is. So we're going to talk more about that. My goal for today is to explain more about pap smears, why you get them, what an abnormal pap smear might mean, what kind of conventional therapies that your gynecologist or midwife or other healthcare practitioner would normally recommend for you, and then what it would mean to come see a naturopathic doctor like myself here at Anasa, and what other treatment options are available, and specifically talking more about the escharotic therapy that we are offering now. So let's jump right in. So, pap smears. Most of us that have a cervix, we know that we have to get them every year, but sometimes we're not really explained more about it. We know that pap smears are something that we will get now. The guidelines have changed. They used to be anywhere from every 2 to 3 years, sometimes depending on your last pap. Sometimes you won't have to get a pap smear um, any later than that. I'm going to move my face over a little bit so that you can see me a little bit better. Perfect. And so that you can see the screen. Um, so pap smears, why do we get them? Most of us know it's because we're trying to screen for cervical cancer. But there are intermediates before then, which is called cervical dysplasia, which we're going to go into. But first thing, if you've ever been in my office, you know that I like to teach you about your body. So I want to explain kind of what a pap smear is and what it entails. If you had one before, it's a sensitive exam. You go to your gynecologist or midwife, and they will essentially insert a speculum. And the goal is to get to your cervix. So the cervix is basically the edge here that is part of the uterus. And so the cervix is like the ending that opens up into the vagina. And the goal of the pap smear is to get some of those cells. So what happens is a small brush is inserted into the vagina to scrape the surface of the cervix. So the idea is to get right in this area. What they want to do is we're trying to collect the cells in what's called the transformation zone. So the transformation zone is an area around the opening of the cervix where what's called the endocervix, which is right here, meets the ectocervix. So endo means in, ecto means outer layer. So the endocervix is closer up into the uterus where the excuse me, the ectocervix meets the vaginal canal. And so This transformation zone is important because this is where two different types of cells meet. So the endocervix, because it's up closer to inside of the uterus, there are what we call glandular cells in there, and glandular cells make mucus. And anyone that has a uterus and a vagina knows that mucus comes out of there and you'll have discharge. So these cells make part of the mucus that can come out of the vagina. There are other glands and things like that that do that as well. On the ectocervix, what's there because it is in the vaginal canal and it's what facing the vaginal canal, it has something called squamous cells. So squamous cells are our rough and tough cells. So anywhere on the body where we can be exposed to a lot of friction, there's going to be some squamous cells. So think of like your arms and things like that. These cells are durable. And you think about this is if the ectocervix, that outer part of the cervix, is facing the vagina, and if you're having sexual intercourse with penetration, you want those cells to be durable. And so that's where the squamous cells come in. Now, why is this transformation zone important? Because this is where these two different types of cells meet. Anywhere in the body where there's two different types of cells that meet, where there are many places, is a place where there's cells that are constantly changing. And because of this, the higher rate of overturn of these cells is where cancer can happen. Another place where there's these two opposite cells meeting is in our esophagus. So our esophagus is the tube that connects our mouth to our stomach. Right where our esophagus meets our stomach is where two different type of cells meet, similar to this um, in the cervix. And so what will happen is sometimes with chronic acid reflux, that's where a lot of those cells will change and can increase your risk of cancer. So anywhere there's the body has two different types of cells that meet, it can cause some issues there. So that's why it's important that when you get your pap smear, that your healthcare professional gets this transformation zone because that's where the cells that are constantly changing are going to be. And that's where we usually will be able to screen for cervical cancer, any changes. And so, for the most part, because the squamous cells, depending on sexual activity, things like that, are exposed to friction, they're constantly sloughing off. And so your body constantly has to replicate those cells. And whenever your body's making more of cells in some place, higher turnover rate, that's where cancer can happen. So most of the abnormal cells of the cervix occur in the squamous cells. So I've talked a lot about cervical cancer, but it takes about anywhere from 10 to 15 years for abnormal cells to eventually turn into cancer. So cancer is not something that's diagnosed immediately. Um, for the most part, if you're getting your regular pap smears, what happens is you can actually get abnormal cells even before you have signs of cancer. And so that's why it's important to get your regular pap smear. Um, okay. Oops. See. My technology skills aren't the best here. Okay. So I mentioned escharotic therapy is a treatment for cervical dysplasia. So what is cervical dysplasia? Cervical dysplasia is why those of us with a cervix get a pap smear because these are those abnormal cells. So the cervix, as I mentioned before, is a lower narrow end of the uterus that forms the canal that connects the uterus and the vagina. And when we get the pap smear, again, we're trying to get in that transformation zone. So what we're looking at here is a zoom in of that transformation zone. And so this is what is supposed to look like. So you see down here, these are those squamous cells. So they're really thin, wider than up here where those glandular cells are that create mucus. So this is exactly what those cells should look like in that transformation zone. What happens is, for various reasons, we're going to talk about risk factors for cervical dysplasia, is there can be abnormal cells there. And sometimes they're precancerous, sometimes they're not. And so cervical dysplasia is the medical term for abnormal cells of the cervix. So it doesn't mean that it's cancer. So if you've ever had a pap smear and it's come back with abnormal cells, that means you were diagnosed with cervical dysplasia. And there's different types of cervical dysplasia or abnormal cells, which we're going to go into. So these are the types that we'll see normally when you get your pap smear back. So this is what a quote unquote normal looking cell should look like. The squamous cells down here, the glandular cells here. You'll notice things aren't crowded. They're exactly where they're supposed to be. Once things start to progress, which we'll talk about what each of these mean, you can see the differences in the cells here. Um, you can see that those glandular cells have really kind of changed, and the squamous cells are getting squished and moving. You'll also see the little purple dots in here. That's the nucleus. So the nucleus of the cell is where your genetic material is. So that tends to change too when you get abnormal cells, and eventually it could progress to cervical cancer. So we'll talk about that too. Okay. So what are the types of cervical dysplasia? Once again, gonna move my head so that you can see a little bit better. Maybe I make my head a little bit smaller to get it out of the way. Perfect. So what we're looking at here are the types of cervical dysplasia. So continuing the from the picture that was on the previous slide. We talked about normal cells. So if your pap comes back normal, there's no changes in those cells. Now, there's different types of abnormal pap smears or cervical dysplasia, and they're graded on severity. Sometimes you'll see different words used on the report. Um, Things that most likely come up are L-sil, H-sil, ascus, or atypia or atypical glandular cells. So low-grade intraepithelial lesion or L-sil. So what this is, it's a step up from normal cells. So it's not as severe as H-sil or cervical cancer, but what's happening is that there are some cells that are changing. So it's low grade, whereas high grade, as you can see the difference here, there's some more changes in those cells that are more severe than the low grade, so it's high grade. Ascus or atypical squamous cells of undetermined significance. So we talked about squamous cells. Those are on the ectocervix or the outer edge of the cervix that meets the vaginal canal. And those squamous cells are the ones that usually have an issue and will usually have abnormal cells, like we said. So ascus is actually the most common abnormal finding on pap smear, and it can be caused by things like HPV, inflammation, low hormones, even menopause can cause that as well. Or things like a non-cancerous growth, such as a polyp. So it doesn't necessarily have to be caused by HPV. A lot of us, we learn about pap smears and HPV causing cervical dysplasia or abnormal cells of the cervix. But it's not always the case. Sometimes some other factors can cause that as well. You might even see on your pap results atypia. It's just another word for not typical or abnormal cells. And then, similar to the atypical squamous cells, you can also have atypical glandular cells. So, those cells are the cells that are up into the endocervix, so closer up towards the uterus than the ectocervix, like we talked about, that has those squamous cells. Okay. And then next is what happens when you get an abnormal pap smear. So say you get your pap smear and it comes up with one of those results that we mentioned before, the L-sil, the H-sil, the atypia, the ascus, or the atypical glandular cells. Depending on your results, your doctor will most likely also test for HPV, and also depending on your age as well. But more likely than not, they'll recommend something called a colposcopy. So if you've had an abnormal pap smear before and you've had a colposcopy, then you're familiar with what that is. Essentially, what it is, it's a way for your healthcare provider to magnify the cervix. So what happens is they use a light and a microscope to help zoom in on that. And it's pretty cool. They use acetic acid or just vinegar, which they apply to the cervix. And what happens is it actually colors those cells that are abnormal and they turn white because the vinegar actually is able to break down some of the cells. And so you can see those abnormal cells and it helps to remove some of the mucus as well. And so what they'll do is wherever those abnormal cells are, they'll take a biopsy or a small tissue sample, and then gets sent off to pathology to look at that. This is an important step because what can happen is you can have abnormal cells on your cervix, but you could have a normal colposcopy, which is a good thing. But it's important because this will tell us how severe the dysplasia or abnormal cells are. And usually, what it'll come back as is one of the four of these, which is normal, CIN1, which is cervical intraepithelial neoplasia, which is medical term for changes of the cell. So, AKA mild dysplasia. So, something like LSIL, like we talked about before. There's also CIN2, which is more moderate dysplasia. This is something like HSIL. And then you'll see CIN3, which is actually what we call carcinoma in situ. So this is severe dysplasia, and this is the closest to cervical cancer. So the colposcopy is important. If you're interested in doing the escharotic therapy, this is something that I usually will make sure that you've had done before we meet, and you bring your results of your pap smear and your colposcopy so that I can look at them. Because if your pap smear says one thing, colposcopy says another, that really determines what kind of treatment is best for you. Okay. And then more information on CIN1, 2, and 3, like we talked about. So similar, you'll see normal cells. CIN1 is that mild dysplasia. CIN1 and CIN2, for the most part, have about a 90% clearance rate of infection, which is great. Um, but you'll see how the HPV or the human papillomavirus can affect this as well. So as the numbers increase, the more severe the abnormal cells are. So CIN1 is mild or low grade, usually resolves on its own and doesn't require treatment. So things like LSIL. CIN2 is moderate and typically treated by removing the abnormal cells. So we're going to talk about conventional treatments for that as well. And then CIN3, this is severely abnormal. It's not cancer, but it's pretty close to it. So that's when things like more aggressive therapy would be warranted. Okay. And then let's get into the risk factors for cervical dysplasia and cervical cancer. So, what can cause an abnormal pap smear? As most of you know, it's HPV. It tends to come up number one. So, this is human papillomavirus. So, we're going to talk more about this too. But what will happen is if you come back with an abnormal pap smear, your gynecologist or healthcare professional will usually test you for HPV. Like we mentioned before, sometimes atypical cells or cervical dysplasia isn't caused by HPV. It can be caused by inflammation, polyps, or even low hormones. So it's important to get an HPV test as well. There's so many different strains of HPV. We're going to talk about those. There are high risk strains. Two of them most high risk are HPV 16 and 18, and these cause about 70% of cervical cancers worldwide. So it's really important to get that HPV testing as well, just to understand your risk of progression to cancer. Other factors for abnormal cells include smoking, HIV, chlamydia. So you think of any kind of infection that's going to mess with the vagina and the area that is close to the cervix. Poor nutrition. So, if you've met with any of us at Anasa and have seen one of our lovely naturopathic doctors here, we really push the importance of food as medicine. Multiple sexual partners can also increase your risk, especially if you are having sex with cis males. They tend to not show signs of HPV for the most part. So they could be carriers and you could be infected with that as well. Obesity. We're now learning that oral contraceptives or birth control can actually increase your risk for cervical changes, and that's mostly because of the hormone changes and then age. This is actually one of the good things that come with aging is that your risk actually declines as you age. Okay. And then HPV. So more about this. So there's over 100 different subtypes that we have been able to find out. 30 plus types can affect the genital area. So sometimes HPV can show up as warts. They are usually what are called cauliform warts, meaning they kind of look like cauliflower. Um, and it does not mean that just because you have HPV, you'll end up having warts. Some people won't. Um, Different types of strains will cause warts and some won't. So low risk types like 6 and 11 usually cause those genital warts, but the most aggressive high risk types, you'll see I have a list of those, 16 and 18 being at the front. And there's an estimate of about 70% of women have or are infected with HPV. And it's one of those viruses that's similar to chickenpox. And so, like chickenpox, you can get it when you're younger. It can lie dormant in your body and show up as shingles. HPV does the same thing. So I see a lot of patients where they'll have abnormal pap smears or they'll test for HPV when they're younger and then they're fine for most of their adult years and then they hit menopause and because of the hormonal changes, they'll test positive for HPV again. And that's because it resurfaces. So, your body might have been able to handle it when you were younger, but other factors could cause it to resurface. And this is where naturopathic medicine comes in because we're all about the whole body approach, looking at you holistically, figuring out what your immune system's like and all of those things. So we're going to talk about naturopathic treatment as well. But HPV doesn't only necessarily cause cervical cancer, it can also increase your risk of other cancers like vulvar or vaginal cancer, also cause penile cancer, anal, mouth, and throat. And like I mentioned, it can lie dormant in the body and reactivate, similar to Epstein-Barr virus, which we talk about a lot as well. So now that you know about pap smears, why you get them, what those results can look like, your risk factors, and more about HPV, let's talk about conventional treatment. So this is treatment that your gynecologist or midwife or other healthcare professional would recommend for you. So depending on the type of cervical dysplasia or abnormal cells of the cervix, your doctor will recommend treatment, or for the most part, most doctors, depending on your results of your pap smear and your colposcopy, they will just recommend waiting and repeating your pap smear every year, or even doing the HPV vaccine if you come back positive for HPV. So, conventional treatment goal is to remove or destroy those abnormal cells that have a high chance of progressing to cancer. So, say if you got an abnormal pap smear. It continuously progresses to things like HSIL or CIN2. That's when doctors will most likely recommend one of these treatment options. The one that is recommended most often is the LEAP procedure, which is the loop electrosurgical excision procedure. So what this entails is it's usually a treatment that's done in office with your gynecologist, and they use a thin wire that ends up cutting part of the cervix, so it removes those abnormal cells. There's also more just invasive therapies like the cold knife conization or the cone biopsy, some other therapies as well, depending on how severe it is, which can include being under general anesthesia, so having to go in for surgery for these as well. But the LEAP procedure tends to be the number one and most common treatment because, for the most part, because it takes a while for cervical cancer to progress, about 10 to 15 years. If you're getting irregular pap smears, you're going to catch it early. And that's when they will start doing treatment sooner than later, depending on your results. But for the most part, it's kind of a watch and wait situation for conventional treatment. The one thing with the LEEP procedure is that because it's removing part of your cervix, there are risk factors like infection, but usually one of the highest risk factor for a lot of patients looking for other treatment as opposed to the LEEP procedure is the fact that it can cause scarring of the cervix. And so if you think about that, scarring of the cervix is naturally supposed to dilate, especially if you're giving birth. So scarring there can actually mess with the cervix and make it harder for you to give birth. Which, if fertility is something that's on your mind, that can definitely affect your decision to do the LEEP procedure. If you get something like a cone biopsy, too, or even more invasive treatment where they're cutting out a large chunk of the cervix, what'll happen is your cervix won't be able to hold a fetus, hold a baby. So that will increased risk for infertility as well. So this is why a lot of patients are looking for different treatments, and that's where naturopathic medicine comes in. Okay, so we finally get to the good part, naturopathic treatment options. So this is when we're going to talk about that escharotic therapy that I'm offering here at Anasa, but also some other treatment options as well. So for the most part, for patients, they'll tell me that they have had an abnormal pap smear, and I don't recommend escharotic therapy for everybody. Sometimes you don't need that type of treatment, but I also don't like to lie in wait. I think that the difference between naturopathic medicine, one of the main differences between naturopathic medicine and conventional treatment of abnormal pap smears and cervical dysplasia is that we don't like to lie in wait. I rather treat you now, even if it means just supporting your immune system and other parts of the body. So anytime you see a naturopathic doctor, specifically myself, is we're going to try to figure out why your body is having these changes. If you do have HPV, why isn't your body able to clear it? What's going on with your immune system? Is there anything else, any other infections that could be causing some issues for you? I've seen a lot for patients too, is if they have abnormal periods or hormonal issues and hormones are kind of out of whack for them, that can also increase their risk of having abnormal pap smears as well and not being able to clear it. It's so unfortunate that doctors just kind of wait and see what happens. Yes, it's sometimes, you have a higher chance of clearing that HPV when you're younger, or some of the abnormal paps end up coming back normal the year after. But supporting the body is important, especially because when you think about where the cervix is compared to everything else, it's hard for your immune system to get there. And sometimes you need a little push. And what better to do that than to treat the cervix directly while also helping with your body's own natural defenses. So this is when escharotic therapy comes into play. And it's a great alternative to a leap therapy, but also it's something that you can do um, initially, and you could still eventually do conventional treatment as well. And depending on if you've had a leap or a cone biopsy before, it is possible to have an escharotic done as well. So, escharotic therapy, it's an alternative option to treating abnormal cells of the cervix or dysplasia. This therapy, the main thing is it really offers patients a non-cervical option to treat their cervical dysplasia as opposed to the LEEP procedure, which we talked about before. And so it's less invasive. Escharotic therapy, it involves herbal agents that are directly applied to the cervix. And what it does is it forms an eschar or a scab on the cervix. And the goal is to help kill off those abnormal cells. So we're going to talk about what that entails and how that treatment is done. So eschar creates a scab to remove cells. And this is not just the treatment alone. I usually will recommend vaginal suppositories that go with this, and as well as just an entire holistic naturopathic approach to helping to support other parts of the body. It's never just the cervix. We also want to make sure that everything else is optimized so that you have a better chance of getting a normal PAP after, but also keeping that PAP normal. Okay. So, what to expect? So, let's talk about what an escharotic therapy entails. So, what it is essentially is, like I mentioned, applying herbs to the cervix to create a scab to kill off those abnormal cells. So you see on the right-hand side is this beautiful flower. This is called sanguinaria or bloodroot, and this is one of the herbs that are applied to the cervix. So essentially, bloodroot, it's what we call caustic. It's a poisonous herb, and what it does is it causes burning or scarring when it's applied directly to the skin. And so what this does is it helps to scar those cells on the cervix, not to the point where it's creating a permanent scar, like something when you get a biopsy or you get tissue removed with a leap. It's a temporary scarring or scabbing of the cervix that then will promote your immune system to regenerate those cells and remove those abnormal cells. So during the escharotic, what happens is a speculum is inserted so that we can visualize your cervix. And then what I do is I use a mixture of bromelain, which is an enzyme that comes from pineapple. And what this does is this powder is puffed onto the cervix with a little pipette and it covers the entire cervix and it stays on your cervix for at least 15 minutes and we put a light on there to warm up the area. And bromelain is an enzyme. So what it does is it helps to break down the cell wall of those cells of the cervix. So it's breaking everything down to get those ready to be um, essentially burned by the sanguinaria or the bloodroot. And so once the bromelain is added, I actually like to also add something in, which is something that I've created clinically myself with research, is something called EGCG. This is a type of green tea extract that is really well studied for HPV and cervical dysplasia. So I mix that with the bromelain and I add that onto the cervix and let that sit for 15 minutes. Once that is done, what I do is I apply something called calendula, which is a flower that is very nourishing for the body. So you might have seen it in things like salves or lotion, skincare products, because it's very calming, nourishing for the skin and helps to reduce inflammation. So that helps to wash off that bromelain and the EGCG. And then what I do is I apply some of the sanguinaria or the bloodroot tincture directly onto the cervix. And this only stays on for about a minute. Some doctors, those that I was lucky enough to learn this treatment from, also use something called zinc chloride, which is a prescription that is used to burn off those cells of the cervix. It is corrosive, um, and so I don't like to use that in my therapy. I like to use the bloodroot on its own, using the natural herbs, and I just use a higher potency of that and put a little bit more on to make up for the zinc chloride. And so this, what it's doing is it's burning off those cells and creating that scab or that eschar. And that only stays on for about a minute. And then I wash that off with the calendula. And then what I do is I insert a vaginal suppository up onto the cervix that has some herbs in there like thuya, tea tree oil that help to promote the immune system and help to kill off the HPV as well. It also has some nourishing oils in there to help with the area too. And so that treatment usually lasts about 30 minutes. So it is quick, which is great. Your first thought, you're probably like, she's putting things on my cervix that are gonna burn it and or create a scab. I know, doesn't sound comfortable. For the most part, most patients will experience some mild cramping. Because the calendula is really nourishing, we try to make sure that we clean all of that blood root off of your cervix and not get it on the vaginal wall or anything. But everybody's a little bit different. So we always talk about sensitivity to the treatment, expecting a little bit of cramping. There can be some spotting or bleeding after. But depending on how the first couple treatments go, we really go to what you're comfortable with and what symptoms. I always tell my patients that every body is different. And so not everybody is going to be able to um, take this treatment. Some are a little bit more sensitive than others, but for the most part, it is safe and usually doesn't cause many symptoms. And for treatment, what I recommend is at least 12 treatments total. So I either will recommend doing that once per week for 12 weeks or doing 2 treatments per week for 6 weeks and having at least 3 days in between treatments because that's what's been most well studied, used by naturopathic doctors and has found to be the most effective. It also gives your cervix some time to heal as well. And then what we will do is after those treatments, continue some vaginal suppositories to help with the cervix so that it can grow the tissue back and so that it's healthy and also stimulating the immune system to get that HPV out of there as well. And then it's only one part of the process. So, al along with the escharotic therapy, I'll recommend some kind of supplemental support depending on what else is going on in the body so that you're getting that internally, but the cervix is also being treated. So, this is something that you don't want to take lightly. This is going to take some time and being proactive, and it's something that you have to think about. And um, invest time in, but you're not alone and I'm here with you. So, we talk about this during your first appointment and what to expect and all of those great things. But our biggest reason is trying to figure out the why and the how. So, one of our naturopathic principles is treating the root cause. And so, we want to figure out why your body is either not clearing the HPV or your cervical cells aren't changing, and doing that, but while also treating the cervix and helping with just balancing your body as a whole. And so I will usually give patients some nutrition, dietary lifestyle support, and then some supplements to take internally as well, as along with the vaginal suppositories. And then after treatment, usually we'll do some vaginal suppositories after for about 6 to 8 weeks, depending on severity of your pap smear. And then from there, just giving the cervix some time to just heal itself. And then hopefully, depending on treatment and things like that, getting your next pap smear in about 6 to 8 months to see if there's have been any changes. And we kind of go from there. So, I get a lot of questions from patients about this. And so I've listed a few of them here so that I could answer some of them. So I get the question, is it for everyone with cervical dysplasia? No. And that's something that we talk about because what I'll do is I'll have you um, schedule a first appointment with me, which is similar to my new patient's appointment. So we'll have a 75-minute appointment where we talk about your pap smears, your colposcopy, anything else that's going on, your past medical history, all of those things. And we talk about whether escharotic therapy is something that we can even just recommend for you and if you would be a good candidate for that. I know a lot of patients expect naturopathic doctors like myself to always choose the naturopathic treatment, and that's not true for myself. I'm in the middle, along with my colleagues as well, as our goal is to get you feeling better and making sure that we do that in the best way possible. And sometimes that means that it's not going to be the naturopathic treatment, and sometimes you have to do the conventional treatment, like the LEAP procedure. But there's always things I can do to help support you post-op and helping with just everything that comes with that, and also helping your immune system and things like that too. I will get a question like, is it a cure? It's not. There's no definitive naturopathic cure for cervical dysplasia or HPV, but it's definitely helpful. Can this be done for cervical cancer? No, I will not treat cervical cancer with escharotic therapy. That's when I really defer to the gynecologist or your other healthcare provider in choosing the more conventional treatment, because at the end of the day, I want to make sure that you're okay. I do not perform gynecological exams and pap smears in office. I do the escharotic therapies, but I do not do pap smears in my office. And that's mostly because naturopathic doctors here in Rhode Island are unable to take health insurance. And so the whole process of doing it out of pocket and finding a lab for that can be very frustrating. So I usually will refer my patients back to their gynecologist to get a follow-up pap smear. And then, is there anything else that's required for treatment? So, like I mentioned before, it's not just the escharotic therapy. So, I will usually recommend vaginal suppositories to use along with a full treatment plan, which can include supplements, dietary, and lifestyle changes. Do I have to set up an initial appointment, or can I just book treatments? You have to set up an initial appointment. Even if you're a patient of Anasa, you will still have to set up an appointment with me. If you're a patient of myself or Dr. Cardarelli, Dr. Els, or Dr. Kaz, I do offer shorter initial appointment treatments where we would have a 1 hour appointment rather than a 75-minute appointment, and we would talk about more cervical health, because I will have notes from your previous provider. But I do require an initial appointment before so we can really dive deep into your medical history and talk about your pap smear, talk about your colposcopy, talk about your HPV results, and we talk about all of the treatment options for you and what I think would be best. Another question I get, is it safe? So like I mentioned, every body is different. For the most part, it is safe. You could have a little bit of the cramping and things like that, but we use herbs that are well tested, and this treatment has been used for so many years, and I've had the pleasure of learning these treatments from other naturopathic doctors, and they have really great success rates with this. Do I treat anal HPV or other warts on the body? No, I know some of my colleagues do, but I do not do that. Is it covered by insurance? No, like I mentioned, naturopathic doctors in Rhode Island cannot accept health insurance, and health insurance usually wouldn't cover something like that either. Does my gynecologist or midwife know about this treatment, or can they perform it? Usually, no, they won't know about this, and therefore they won't be able to perform it. I am more than happy to explain it to them, or talk with them about this treatment, but for the most part, most of them don't know this. And then, can you do a conventional treatment after escharotic therapy if needed? Yes, you can. I had mentioned that before too. So there's always an option, because sometimes it's not 100%. I can't never can guarantee that the escharotic therapy will for sure remove those cells or clear the HPV. And so if that's the case and your pap smear still comes back abnormal or gets worse, then I will definitely recommend going for conventional therapy. So I hope that answers some questions that might be popping up in your head. But if you do have questions, I always recommend booking a 10-minute free informational consult. So that's something that you can actually book with any one of our doctors, no matter what um, appointment you're looking to schedule. It's a great way to kind of ask some questions, and I can always let you know if I think it's a good fit or I think it would be worth booking an initial appointment. So, like I mentioned, an initial escharotic consultation is required before treatment. That way, I can kind of determine your eligibility for treatment. We can discuss possible treatment options, and we can review the specific details of the escharotic therapy and what to expect, along with pricing and things like that. And the initial escharotic consultation is available to established patients as well as new patients. So please feel free to reach out to us. I put our contact information here, but you can call us, book an appointment online. But I definitely recommend setting up that 10-minute informational consult so we can go over that. So you can always let the front desk know that this is something that you're interested in, and I'll be more than happy to answer some questions for you. And like I said, that initial escharotic consultation, if I think that the escharotic therapy would be a good fit for you, then we would talk about booking those treatments. But I usually recommend and require at least the 12 treatments total, which can be either once a week for 12 weeks or two treatments for a total of 6 weeks. So that's all the information about escharotic therapy. Thank you so much for joining me today. Like I mentioned, if you do have any questions, you can always call the office. Our contact info is here as well. You can visit our website, which is anasamedicine.com, and we'll be more than happy to answer questions for you. I hope this kind of cleared up a lot of different questions that might have popped up, and I hope you learned a little bit more about pap smears, cervical dysplasia, abnormal pap smears, and what naturopathic doctors and treatment has to offer. And I look forward to potentially meeting with some of you that are interested in this and getting you on the path to hopefully a normal pap smear. So thank you so much for joining me today, and I hope you all have a great rest of your day. Take care.